Hi everyone, my name is Jisoo and here is Zoe. Together we are going to present for asthma and COPD. What is asthma? Asthma is a long-term condition that affects the airway in the lungs. The airway can become inflamed and narrow at the time. This makes it harder for air to flow out of your airway when you breathe out. There's no cure for asthma, but treatment and an asthma action plan can help you manage it. The plan may include monitoring, avoiding triggers, and using medicine.
COPD is chronic obstructive pulmonary disease. It is the result of damage to your lung air sacs that destroy the walls inside of them and causes them to merge into one giant air sac. The lungs can't absorb oxygen as well, so you get less oxygen in your blood. There's no cure, just management of the disease.
The signs and symptoms for asthma can be labored breathing, wheezing, sleep problems, chest pain, frequent coughing, allergies, common cold, and feeling tired.
Signs and symptoms of COPD. For people that have chronic bronchitis, they are going to have chronic productive coughs, mild dyspnea initially, cyanosis, peripheral edema, wheezing, prolonged expiration, and obesity. People with emphysema are going to have dyspnea, minimal coughing, pale skin, pursed lip breathing, hyperinflation causing a barrel chest, and tachypnea.
Common treatment for asthma, we have both two options. Inhale corticosteroid, that's for persistent asthma intended for long-term use. And oral corticosteroid, it's for severe asthma attacks, that's for intended for short-term uses.
Common treatments and medication for COPD, smoking cessation, avoidance of pulmonary irritants, vaccination against influenza and pneumococcal, using short and long-acting bronchodilators, antibiotics, supplemental oxygen, pulmonary rehab, and monitoring the disease progression.
The drug side effects for asthma, inhale corticosteroid, there are fewer and less severe effects such as headache, sore throat, common cold, or muscle acne. And for oral corticosteroid, it's more severe, diverse side effects such as nausea, acne, weight gain, and irregular heartbeat.
For COPD, anticlerogenics are associated with dry mouth, and then phenolphthaleins are rare, but they're associated with the development of Stevens-Johnson syndrome.
And oral signs and symptoms for asthma can be oral ulcer, changes in taste, bad breath, dry mouth, and dry tongue, burning feelings in their mouth.
Clinical oral signs and symptoms for COPD. So people that are chronic smokers will have halitosis, extrinsic tooth stains, periodontal disease, and oral cancer. Factors that contribute to acute respiratory exacerbation is poor oral hygiene, oral bacteria, periodontitis, and then it can also have dry mouth. For the management special cautions in the dental office for asthma, you want to ask detailed questions about the asthma frequency and severity, what triggers it, and the management and medications these patient uses. If they're unstable, they should be referred to medical care, and the dental appointment should be postponed. And always ask them to bring their inhaler with them. COPD, you want to just prevent the potential problems. You want to identify the disease and recognize its physical features and be able to refer to a physician for care. This will also help prevent further progression of the disease. And if they're smoking, provide information on how to stop and why to do so. Social and physiological and cultural barriers factors. Healthcare professionals need to consider and discuss the perception of each individual patient. You want to directly address each patient's unique challenges and refer them to additional healthcare resources as necessary. Poor understanding and the need for treatment and insufficient confidence in the clinician or medication, the presence of physiological problems and low motivation to change behavior. We want to minimize the stress and nervousness associated with dental treatment, and during treatment, we should attempt to avoid any triggers that will trigger a respiratory attack with aerosols and particles. It is necessary to consult and refer before dental treatment for these patients if they are uncontrolled or if they have severe COPD or asthma. They might need a pre-medication if they're immunosuppressed too, and just postpone treatment if they are unstable. And that is the end of our presentation. Thank you.